Mark Noon from the Studer.
There we go. All right. And we got a clicker. All right. Getting organized here. Good morning. Good to be back in Indiana again. A little cooler here. I was in Stillwater, Oklahoma yesterday, and as I was driving back to Tulsa, I got to the airport. Got out of my car. You know, in the car, you're driving, you don't think about what the temperature is, and I wasn't really paying attention to the temperature of the car. You know, the sunshine is a beautiful day, and I get out and I walk in the airport. I'm like, I start to sweat. It's hot. I look at my phone or my watch on my Apple Watch. 85 degrees yesterday in Tulsa, Oklahoma. It was amazing. I mean, it was beautiful, but I'm like, 85. It wasn't even that warm in Florida. It hasn't been that warm at all in Florida where I live. So 85 was kind of fun. And then get here and have 40 degrees this morning. It was a little cooler, but not bad. Anybody new? Wasn't here in January that I had not met? Quite a few. Okay, good. Well, I love the way people introduce themselves. I'm going to do it a little bit twist to it. So, for those of you that don't know me, my name is Mark Noon. And for those of you that do know me, my name is still Mark Noon. So just in case you were wondering if it changed. But people do that, right? We introduce ourselves like is it? Well, if you don't know me, this is who I am. But if you do know me, I must be somebody different. So we're going to have a good time today. I hope we're going to have a good time today. And I do get excited about employee engagement, Teresa. That is really my, what motivates me, what I'm passionate about. You know, when you think about the healthcare flywheel, remember that one? And the self-motivation, the passion part of it, that's what floats my boat, so to speak. That's what gets my flywheel turning. I was in Stillwater yesterday. Stillwater, Oklahoma, Stillwater Medical Center is an amazing hospital partner of ours. They have, and I was just telling Steve this a little bit ago, there are a few hospitals, honestly. We coach 400 hospitals around the country. There are a few hospitals that have really good engagement of a lot of leaders, and even fewer that have really good engagement of their CEO. And Steve is obviously one of those. You guys know that. And yesterday I was in Stillwater, and Denise is the CEO there. I mean, I love going to organizations where the CEO is so involved and knows what's going on, and not a micromanager knows what's going on, but is so much wants to be involved. That so much so I was in. So I have nieces and a sister-in-law in Tulsa, and so I went to Tulsa early on Monday. I had spent some time with them. I'm out on this little hike with my nieces who are like 20, 22, and 27, I think. And I get a call in the middle of the hike because it's the duty day, the work day, and I'm kind of supposed to be available, but I'm out on a hike with my nieces because I just had a little bit of time. And I get this call, and it's Denise, the CEO. And I'd never met her before, never talked to her on the phone. I just knew her name, and she calls, and it's like one of those, you get the phone call, you kind of, it says Stillwater, Oklahoma on my phone, so I know it's from them, and I answer, and she said, "Hi, Mark, it's Denise from Stillwater." And I'm like, "This is the CEO. Like, why is she calling me?" I'm thinking, am I in trouble? Did you forget something? Was I had the wrong day? Am I supposed to be there that day instead of the next day? And she was just so inquisitive about making sure that I had everything I needed for the LDI, that we were aligned. The stuff that she was going to present was in alignment with what I was presenting and so on. And I just thought that was kind of the coolest thing. And I complimented her yesterday in front of her team because that doesn't happen in a lot of places. So I say that to encourage you that you really have a fantastic CEO, which you probably already know that, who is very involved and who is available and who is connected. Steve and I were also talking about 90-day plans. You guys do the LEM, right? If you don't do the LEM, then you're probably on the lam because you're running away from it. But where's Jeannie? Jeannie, right back there. Jeannie, so I heard this great stuff about you, Jeannie. Like, you have the most fabulous 90-day plan ever. Is that true? Right? Yeah. Well, true. I don't know. Maybe I do, right? So now everybody's going to go check out your 90-day plan. They're going to stalk you like Teresa stalks my Twitter account, right? And so I think that's fantastic. But you know what happens? In a lot of organizations, that doesn't happen. You know what a 90-day plan is? Show up to work. I mean, that's really what people write in their 90-day plan. Like, 90-day plans will really drive your results. They really, really will drive your results. My daughter, who's 22, had to write a paper recently for school, and My kids always, I don't hear from them for weeks unless they need money or they need help with a paper in college. And so she writes a little text, Dad, I need help with a paper. And then the key words, you want to know keywords? On leadership. So that gets my attention right away. She knows the key words to use to get Dad's attention. So of course I help her with the paper. But part of her paper, I teach my kids this, Jeannie, is in the leadership paper, she talked about how her dad taught her to do 90-day plans in order to get to her goals. That's some cool stuff. I appreciate you doing that. I think that's a good example. If you haven't seen, you guys go on the web now and look at Teresa's 90-day plan. But give her at least a day to touch it up a little bit, make sure that it's the way that it's supposed to be before you do that. Let's see, what else is going on? I wrote down some notes here. Oh, you know, in one of the values of Student Group, so we have values like everybody else. And if you can't quote your values, I encourage you to learn them. I know we put them up on the LDI, and hopefully you talk about them often. But, you know, everywhere I go, I've never found an organization yet who said, any one person stand up and quote all their values. But here's one of them, Student Group, is measurable outcomes. We don't do anything unless it can be measured, and that we can have an outcome to it. You know, I grew up in a military world where we collected a lot of data and we sent it off to some higher headquarters. We never knew what anybody did with that data. We never saw any result from it. We never saw any outcome. And I noticed the results from the last LDI, which I was pretty impressed with. But here's measurable outcomes, Student Group mindset. I saw the results, and I looked at how far the graph was going, and I saw Steve's name, and I saw my name. And I really wanted to get a tape measure out so I could measure and see if mine was just a little bit higher score and longer than Steve's was. I'm not sure if it was. The numbers weren't up there, just the graphic. So anyway, we've got to have measurable outcomes because we're motivated by that. Part of the LEM and part of the 90-day plans is that ability to be able to get to the goal. And I like how you tied in the aligned behaviors, aligned goals, aligned processes. Something else I think is kind of cool. You do a stoplight report for your LDI. So you said, here's what you told us last time, or a couple times before. Here's what we've done. Here's what is in progress. I love it. I would encourage you, so we're there to go. So I would encourage you in your LDI team, True Sigma team, is, you know, we are developing an LDI page, a learning page on the Student Group website. So I would love to see your video that you did, and if you would allow us to you know, put that on our website or link it to your YouTube video, and that stoplight report idea I think is really great. So if you guys would, if you would be okay with that, and again, just don't say yes, but talk about it with your team, make sure it's okay with your CEO as well. But I would love to have you send me that or links to it, and we would put that on our website. Because I think other hospitals need to see that. And that's the cool thing about what you guys do and where you are. I love your vision of having, you know, being the healthiest county in the state of Indiana. That's big. That's big. Right? This isn't like Rhode Island, where you know half most of the state can fit in this room. This is Indiana. It's a pretty good sized state. It's not Texas or California, but it's a pretty good sized state. So that's a pretty big deal. I think that's admirable. I had a hospital in Missouri when I first started there. Their vision statement was to be the #1 rural healthcare system or healthcare hospital in America. That was a little broad, a little big. How about we just go with Missouri, first of all, right? Let's start there. And when the new CEO came in, it changed that vision. Because that was a little out there. I mean, I appreciate big vision, but I think that was a little bit out there. What else did I write down here? Well, you guys are in the middle of your employee engagement survey. We're going to talk about that today because employee engagement is my passion, what I'm excited about. And I think some of the stuff that I'll talk about today probably isn't going to help you have any better results on your survey because there's only like a couple weeks left of your survey. But I think it will help you in what you do with the after-survey results. Because here's what happens in a lot of organizations too. We do the survey, we get the results, we have a discussion about it at our table, and then we go away and we do nothing. And then a year from now we do the survey again and we go, oh, I forgot to do all that stuff, right? And then you're scrambling in the last month to try to, you know, get with everybody, around on everybody, do all these wonderful things, and hopefully get some better results. Here's the key to good employee engagement results. My hospital in Arkansas, first year I started with them, they had a challenge to try to get, what I told them was a big goal of 75% participation. They said, Mark, we're going to do better than that. They kind of wanted to do one of those I told you so moments. And they incentivized everybody by giving anybody who filled it out, I don't know how they kept track of this, but ice cream. So ice cream is a good incentive for a lot of people. But this last year, their employee engagement survey, now this is the 4th one they did, 99.6% participation. We had one person in the entire hospital that did not fill out the survey. And they literally, like went through the whole hospital for the last couple days before the survey closed, trying to figure out, not figure out who it was, but to try to encourage everybody. If you're the one, make sure you fill it out. If you're the one, make sure you fill it out. They couldn't get the last one to do it for whatever reason, but maybe that person was just a holdout, and they probably said, hey, I was the one later on. But you know what was great about that is a lot of times when we have a higher participation rate, we end up thinking we're going to have lower results because more people kind of can skew our results or water down our results, and they actually have, in the last 4 years, have gone from 43% engagement to 65% engagement. And this last year was about a 7% increase. So 99.6% participation, and they went up about 7 points over last year. So it was really impressive. So I encourage you, employee engagement is where it's at. We're going to talk about that today in our peer interview kind of talk as well. Also, Sherry, good job on physician engagement. You guys know 88% participation by your physicians as of today. 88%? You can't get 88% of physicians to agree or do anything, right? There's probably some physicians in this audience, I'm sure, but you know how you are. 88%. I was teasing Sherry. I said, Sherry, what were you doing? Like standing over their shoulder, like, okay, hit that button right there. Okay, go over to this one, I know you got patients to see, but that's all right. This is important. That's really good. And I think you're going to see some great results from that as well. So that's kind of cool. Who's in charge of the wound center? What's your name?
Stephanie.
Stephanie, that's right, Stephanie. You guys just got some big national award, right?
We did.
Tell me about that.
Yep, we were nationally recognized for the clinical outcomes.
The clinical outcomes, the wound center.
Yep.
I love wound center. I don't know if I've said that before, but I think wound centers are like the coolest thing, and they're like the up and coming. I love the hyperbaric chamber kind of deal. I haven't been in one yet. Someday I'm going to go in one of those things. I don't need one. I just think it's kind of cool. I come over. Next time if I come back again, I got to plan a little extra time. Yeah, congratulations on that. That's a big deal. So a good award there. What else do I have on my list here? I write down all kinds of things. You know, I'm a stalker too. I go to your Facebook page. I go to your web page. I look for those kind of things. But I did start tweeting when I got here. So that was like the first time I just started with Twitter. Still learning how to use it. My son's helping me. My son's a marketing. Not marketing. He's got a marketing degree, but he's the director of fan engagement at Memphis Redbird baseball team. And so he and I this week are going to work on my Twitter account. So I learned how to do some of these things. So here's my encouragement for you today. And I found this out just the other day. I didn't know you could do this either. Is you can videotape like little segments, and you can put those on Twitter. So I wore my best outfit today, in case you want a video. But if you want to just video a little bit and you want to tweet that out, I'm all in favor of that. So I'm trying to actually work with Studio Group to improve our social media marketing. So that's kind of my goal now. So I'm trying to get some I need like a Twitter for Dummies kind of book, or Twitter for Idiots, or whichever one I am, I'm not sure. But I need one of those kind of books probably to get better. So I'm learning how to do that. 140 characters just isn't enough for me. And I think they're going to raise that, I think, is the plan with Twitter. I can talk, so 140 characters, I'd like to have a tweet out 47 things and get all my message. So I like cut out these words, and I start using these little, short word, instead of the word Y-O-U-U, I put the U, or whatever to try to figure out how to do it. I'm learning to get better. Anyway, what are we at today? What are we doing? Talking about selection. I think selection is it's so important because we have control over who we bring into the organization. And I think we have to have control. I don't mean control like a tight grip on life kind of control or a micromanaging kind of control. I think we need to have the ability to say, I want you working in my organization, I don't want you working in my organization. No offense to you. I know, I heard you could agree with somewhere else, I know. But, I think that's important. And it's not always easy. And I get it. You know what, if we don't have enough people to open the doors, we can't open the door. Who's emergency room folks? Who's at ER? Yeah, you guys, right? I mean, if 17 of your people called in today and couldn't make it to work, we'd have a really hard time taking care of patients. And we'd have to kind of maybe say, okay, you guys need to go down the street. And instead of going down the street, we can't do business. So I get it, we got to have people, we got to have bodies. But putting faces in spaces is not exactly the best way to do business, right? So let's talk about what we're going to move, what we're going to do today. We get that right? Okay, here we go. So some of the things that you already know when it comes to taking good care of your people. Recognition. We know recognition is important. Okay, so recognize gets repeated. We know we lose high performers in organizations because they don't get recognized for doing a good job. You know millennials, maybe I mentioned this before, but millennials, you know how old millennials are now? This is why I feel, last time I was here I told you I just turned 50. And so I'm feeling like millennials should still only be like 20 years old and younger. But really they're 35 years old and younger is considered a millennial. So if you're in this room and you're 35 or younger, you're considered a millennial. You probably don't want to be considered that when you think of some of the things that you hear about millennials. But here's the thing about millennials. They like feedback. Statistically for millennials, now I'm not indicting any of you that are 35 years old and younger here, but statistically they like to be thanked every 7 days for doing a good job. Every 7 days. So here's your mission. If you have people in your department that are millennials, every Monday morning when you show up to work, you just walk in and go, hey, thanks for being here. Thanks for being here. Thanks for being here. You're set. Every Monday, just put it in your 90-day plan, Jeannie, you'll be set, okay? Now, I don't know, man. Honestly, I don't think I've ever met anybody quite like that, but statistically, that's what the surveys say. So take that for what it is, I don't know. But the fact is, here's what another thing about millennials is, they like to job jump. Job jump, is that a good word? They like to jump from job to job. My son loves his job. He's 26 years old, loves his job. Talks about how much he loves his job. Every now and then he'll send me a text or something and say, hey Dad, I just applied for this job at this other organization. Why? You love your job. I don't know, I just want to see what's out there. That's a millennial mindset. So that's tough when it comes to turnover. It's tough when it comes to retention. How do we retain somebody who's looking for another job? Not just because they want another job, they just want to see what's available. They just want to see what's out there. And so we have a tough job when it comes to retaining retention, especially our millennial population. Even now Xers, which because I'm 50, I'm like what we call a cusper. So a cusp is a person that's kind of, they're borderline year, they're either a boomer, or they're an Xer, or they're an Xer, or a millennial, and that kind of thing. So I'm one of those kind of people, born in 65. That sounds really a long time ago, doesn't it? Man, it sounds better to say you're 50 than to say what year you were born. So anyway, but they love feedback. Gen X people really love feedback. They want to know how they're doing. Now millennials do as well. They just want to hear it like, you do a really good job. That kind of feedback. But Xers want to hear, did I do well? Was that did I do that? Could I do that better? And that's all right. But that's a retention idea as well. We have to know how to communicate with those folks. So we think about things with thank you notes. We think about, okay, the millennials, we have to give them a thank you note every 7 days to feel appreciated. Probably not that extreme. And let me tell you something else. Young people do like handwritten thank you notes. So don't think that just because they're young means they have to have just a text or they have to have a pat on the back. They do like thank you notes. What else? Ongoing development. There's the thing for millennials. Oh my gosh. Millennials want to feel like they're continually having the opportunity to grow. And I won't say that others of you are not that way in other generations, but millennials especially. And why am I hitting on them so hard? Because right now, I think statistically, 40% of our hospitals are millennials. 40%. 35 years old. That's a good chunk of people. As the largest, demographic, they are the largest demographic in our hospital. So ongoing development is a big deal. Now here's what I know. What's your name? Kim. Kim in your department is what? Surgery. Now, you're young, Kim. I can tell you're young. She's young. I don't care how old you is. Okay. You're not going anywhere. You're probably going to be in this job for a while. Not retiring like next week or anything. Not like 65 or anything. Okay, right? Unless you've got some kind of miracle age cream or something. But you're not going anywhere. But so anybody that works for you is going to look at it and say, I can't get your job because you're not going anywhere. I won't pick on anybody else who I think might be going. So when we think of ongoing development, they think, well, I can't get her job. Where am I going to go? What am I going to do? I can't move up. I got to move out. So, no, that's not true. We can develop people in your department. Even though there may not be a position opening, we've got to be able to develop people to a point that at least they feel like they can fill your slot should you decide to go somewhere else or retire or decide to make a job change, whatever that might be. So ongoing development is so important. What else? Rounding. You know rounding. Here's my hospital in Michigan. Little tiny hospital. 3 years tried to make healthcare organization of the month. Sorry, that's our word. Modern Healthcare's top 100 places to work. 3 years in a row, they filled out the whole big long 847 question survey. Never made it. We took the rounding log. What's working well, who do we need to recognize, get all tools and things to do your job. Literally laid it out on the table, me and the senior team, laid out there the survey questions from Modern Healthcare. Did one of those things you did when you were kids where you had to match the two columns together by drawing a line? Literally drew a line. Does this question fit our rounding log? Yes, it fits right here. And drew those lines. Every single question on the survey, from a supervisory trust standpoint, matched the rounding log. That was in 2013. 2014, they filled out so the focus was rounding. 2014, they did the Modern Healthcare top 100 places to work, and they were number 87. Just by rounding, using the log, using it effectively. Retention tool, absolutely. Last one, 30, 90-day meetings. We're going to talk about those a little bit more today. All right, so lead rounding on employees, you know that. You know award and recognition. Those are gimmies when it comes to retention and peer interview. Relationship between employer and turnover, we know that. The better the relationship with you as the supervisor, leader, director, manager, whatever your title is, the less turnover we're going to have. Where's our HR folks? Who's it? Right here. What's your name again? Jenny. Jenny, what's our turnover rate? Hospital-wide? 10%? 10% as an aggregate for the whole year, or 10% just for one?
For year to date.
What was it a year ago? And I know maybe, you don't remember. 17%. We're it down to 10%. Is that a big improvement? Huge. What's the cost savings there? How many people does that represent 7%? How many do you think? Estimate. How many people in your organization? 1,100. So 7%, that's somewhere in the neighborhood of 70, 80 people or more. Average cost of recruitment nationally, not healthcare-wide, nationally, is $11,000 per person to recruit. So if you had 70 people at $11,000, that's what? $170,000 savings in a year. Now that's on a national average. Guess what? In healthcare, that's probably got to go up because there's a lot more professional people in the healthcare organization. Cost of a doctor turnover, you know what that is nationally? $250,000. One doctor, one physician. Why is that? Where'd Sherry go? She just got locked right out of here. I don't know that one. So by the way, we're going to take a break in about 20 minutes, so if you can hold off till then. So why is it so important that in physician engagement survey that we retain physicians? $250,000 in lost productivity, orientation, recruitment costs, all of that to bring a new physician back in. Nurses, 3/4 of the year salary. So whatever your average nurse cost is, think 3/4 of that. So if you had, of those 70 people, if you lost 10 of them, let's say the average pay for a nurse is $50,000 a year, 35,000 times 10 is $350,000 just in nurse turnover, if that was the exact number. 2 physicians could cost you $500,000. So in those 70 people, Jenny, by the way, Jenny, I got your number. I listen to Sirius XM radio when I'm traveling, and so the 80s was on this week. Jenny, I got your number here. Anyway. That is right. I've literally been waiting for the Jenny name to come up in one of my LDIs. Okay, where was I going with this? So if those 70 people, if 2 of them were physicians, that didn't become $770,000. Now that became 1.5 million or whatever, right? 1.25 million. So again, that's why this is so important. Your relationship to your staff. But that's we're talking about retention. Today we're really talking about how do we get in the best people, because we maybe have lost some. And guess what? Some people may retire, and some people may move on for whatever reasons, and absolute legitimate reasons. People may move to another place. That's fine. So we're going to have some turnover. But if we can control turnover because Janet says, I don't want to work for Mark anymore because I don't like working for him, that's the kind of turnover I have control over. If she says, I want to move to Florida because, hey, Destin, Florida sounds like a great place to live, and hey, there's that town called Niceville, Florida, that really sounds like a nice place to live. You guys don't remember, that's why that's a different situation. That's a whole family thing. We want to move to Florida. I may not be able to control that turnover. All these things that we just talked about, Janet says, yeah, that's a great place to work. I love this place, but I need to go to Florida. I want to go to Florida. I always want to go to Florida. I get it. What else? Why choose Hancock Regional? That's actually off your webpage. Why choose Hancock Regional? That's on your careers page, I think. I don't know who this person is in the picture. She looks like she's mad. I'm not quite sure. My daughters, when they put their volleyball poster together last year, for some reason, nobody ever wants to smile when they're in a sports poster. So the four girls that are in the poster, my daughter's one of them, they all just kind of stand there looking at you like they're going to tear you up. Got their arms crossed, they're meaning like they don't want to play volleyball. I don't understand. I'm just teasing. That's a great picture. I'm just teasing that. So here's that. Realize that you have the right people in the right place doing the right thing. That's an important thing. So when I think about selection and retention, the selection part is not just even selecting the right people, but it's also making sure they're in the right seat at the table. So I might have the right 4 people right here, but are they actually in the right chair? Maybe I need to move you over here and switch you around here and make that right. That's part of selection and retention as well. Putting them in the right place at the right time. Some of the other things that we know. 90-day turnover. Some of the highest turnover we have in organizations is in the first year, and even higher sometimes in the first 90 days. Especially in your entry level, and I get it. Nutritional services, environmental services, sometimes are some really difficult places. They're entry level a lot of times, the positions in those areas. For you that work in those, this is not an indictment like you're not doing the right thing because you have a higher turnover than some other areas. It's just the nature of how it goes. Right now, nurse turnover nationally is on an increase. So if you're losing nurses, I'm not saying necessarily it's your fault because there is a kind of a national trend. Now we can stop that and there's things that we can control, but some of those areas are just, it's kind of the way it goes. So, but that doesn't mean it has to be. We've got to figure out some ways to make that better. 90-day turnover, a lot of times entry-level jobs is, I need a job, so I go and I work at this place, and then all of a sudden later on I find a job that I've been waiting for, I find another job, and so I move and I get that 90-day turnover. But if we can make this the very best place to work, and people don't leave because they don't like working for Mark Noon, Janet says, I need to move on because I need to have a different job that has a better pay, that takes better care of my family, I get that. So understand where I'm coming from here, we're not going to make it perfect all the time, but if we can do everything possible to get the right people, and everything possible to retain the right people, we're going to have great success. We're going to go not just from 17 to 10, we might even go less than that. And by the way, 10 is a great percentage. We consider anything below 12% in our smaller community or rural hospitals. Anything with lower than 12% is a highly functioning organization. 8% is one of the ideal, like we would consider the culture of high performance would be 8% or less. But that is a very rare place that has those things. All right, so leader development. Today we're going to talk about the skill. Yesterday, I had so much fun yesterday in Stillwater, Oklahoma. This is been a partner of ours for probably 5 or 6 years. They are high performing. They've been Healthcare Organization of the Month a couple times. I think one of their teams is presenting at What's Right Healthcare, our big conference in August this year. So they are high performing. And I was there yesterday, and we were talking about difficult conversations. The new book that Lynn Cunningham and our organization put out called Difficult to Doable, talking about difficult conversations. Now here's the thing about difficult conversations. They're not easy. Therefore we call them difficult. You get that? But when you think of difficult conversations, what's the first thing you think of? Go ahead and tell me. Everybody, that's all I hear. Give us a week. Be bold. Disciplinary situations, exactly. But here's what I found out yesterday, and I knew this before, but I helped them understand this, and this is why I'm talking about when it comes to skill. Difficult conversation isn't always about the low performer in the disciplinary situation. Sometimes difficult conversations is how do I retain and re-recruit my highest performing people? And it's not a difficult conversation because I don't want to have it, Gina. It's because I don't have the skill to have that and really keep that. Because here's the thing, we don't ask high performers. Gina's a high performer. I say, Gina, I don't want to lose you. What's it going to take for me to keep you here forever? We don't say that. Or we don't say this, Gina, is there any reason you would leave this organization to go somewhere else? Why wouldn't I ask that question? I don't want to know the answer. Because I'm afraid the answer might be, yeah, you got to be fired, so, whatever. I'm afraid of the answer. That's a difficult conversation. So yesterday, it was really kind of this like enlightening moment. It was really kind of cool that 120 people in the room all of a sudden went, wow, difficult conversations are all levels of conversation. If I have the difficult, I don't have the skill to do it. So today we're going to talk about skill. Skill in the interview process. How do we interview people? What kind of questions do we ask? It's not an easy thing to do. Because the question, and then the other side of it is not just asking the question, but understanding the answer. So we're going to develop some of those skills today. And talk about this behavioral-based interviewing. So I've been coaching my son the last couple of years because he's in that position last year, this year, where he's hiring people. And so I walk him through how to do these behavioral-based questions. He's 26 years old. He hardly has any experience in anything. Other than being a little brat when he was 2 or 3 years old. That's about the only experience he had. He was rough. We call them, what do we call them? Not difficult children. Strong-willed. There we go. Strong-willed child. That's the pleasant way to put it. He's terrific, though. But, he doesn't have a lot of skills in these kind of things, so I'm coaching him these last couple of years. What kind of questions did you ask? Did you ask this? Remember this? We talked about this kind of question? I actually walked him through behavioral-based interviews. But, sometimes you just got to hire to hire. That's where he was at this last year because they were down a lot of people. So we're going to talk about some skills today. All right, what are the causes of poor selection? What are the causes of poor selection? What do you think? What are the reasons why we don't hire very well? We're going to, 10 minutes. Give me 10 minutes and we'll take it after break. Yes, what's one of the reasons we don't hire well? We need somebody. We got to put a face in a space, right? If emergency department, if we don't have people, can't open the doors. Nursing, if we're really doing well in the ER, where's med surg? Where's the med surg inpatient? Where's that? You guys, right? We don't have staff. Doesn't matter how many patients they want to send up to us, we can't take them. So we got to transfer somewhere else, right? Okay, why else might we not select really well? Lack of applicants. Like we get 2, and we got to hire 3 spots. Those 2, why would I not hire them? They're the only 2. Well, there's a lot of reasons. We're going to talk about why some of those reasons. But I get it. I get it. What else? Why else might we not hire well? Yes?
Don't ask the right questions.
We don't ask the right questions. Yeah. We hire people, we ask them questions like, hey, do you like to do fantasy football? Because we'd love to have you on our team. Right? What else?
You're not honest or not effectively communicating expectations relative to job or culture.
Yes, expectations. Here's one thing, I think Studer Group does a fantastic job. The process to become a coach in the Studer Group, and Deb will tell you this if she hasn't told you before, is really a long process. I think I had at least 5 telephone interviews. And that was our peer interviewing because obviously we're all over the country, so we can't just all be in one place to do peer interviewing. So I had 5 telephone interviews all asking me the same type of questions. And then they did the decision matrix, all that stuff we're going to do today. And then we have to go through a psychological exam at Sperduto and Associates in Atlanta, Georgia. We have to fly to Atlanta, Georgia, go through a day-long test, written test, psychological interview. It's a long process. And guess what? After that, we sit down and we have a conversation. So those 5 interview people, they're telling the expectations of what it's like to be a coach. Number one thing is travel. That's the biggest issue with us. And guess what happens? Every now and then, everybody get all the way through that process. They'll get hired, and a month later they'll go, oh my gosh, this is not for me. I didn't realize it was going to be that much travel. How could you not? We told you 47 times throughout the whole interview. But yet, and that's usually the number one thing we lose people at, travel. And I think we do the best job I've ever seen of any organization in setting expectations. And yet we still, every now and then, hire somebody that's not a good fit. I don't say they're not a good fit from our perspective, but for some reason we didn't communicate expectations really well. So that is absolutely important. Because some of your jobs, it sounds nice on paper, right? I can tell you that Steve, when he thought way back in the day, I might like to be a CEO someday. I'm going to work my way there. That's a pretty cool job. Look at that guy, gets to be on TV, whatever. There's days he goes home, tells his wife or his kids, I don't know what the heck I'm doing. Why am I here? What was going on? Why did I decide this was my job, right? I get it, we have moments like that. Why else might we not hire very well?
We don't follow our intuition.
Yeah, sometimes we don't follow it. We will go through an interview, have all the right answers, and then say, nah, I don't think that's the right person. Or, oh, I really think they're the right person, and everything else doesn't fit. There's a lot of, what else might be? What else?
We don't do an effective job of getting credible references.
Yeah, we don't, it amazes me how many jobs, when I was in the military, I had a full-time job, but I always had these part-time jobs. Like, at lab, we can just work anywhere, I think, right? I had all these PRN, literally my entire military career, I had PRN jobs on the weekend lab. I can tell you that every single job I ever applied for, I had to put references. And I can tell you that nobody ever contacted my references, not once. Not once, ever. Because I would ask you, hey, did you ever get a call from this employer about me? They'd say no. Never. Why else might we not hire really well?
I've noticed that now people are very prepared when they come in.
Yeah.
There's tests for, even one of my sons works at Toys R Us, the test is online. They tell you exactly what you're gonna be, because they come in well prepared,
Yeah.
knowing how to answer.
How to answer the question. So they might snow us a little, right? Fool us, they can, yeah.
They're very,
That's potentially possible.
no, it's very possible.
Yeah. 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 That's why we have the 90 day, that's right, that's why we have the 90-day probation period, because then we really find out what they know and what they don't. I told you I was in Tulsa 2 days ago, and my niece, who's 27, had to go for a job interview somewhere, and she was totally unprepared for behavioral-based question type. And it wasn't that she hadn't had any experience to share, it was, the question she told me was this. The question she was asked was, what would you bring to this team? What good things would you bring to the team? She had no idea how to answer that. And she's very shy, she doesn't articulate very well. But I told her, I said, Chelsea, her name's Chelsea, I said, Chelsea, when you get ready to do the next interview, you let me know, and we'll walk through this thing. I'll coach you through this thing. It's not that hard. I know you have the experience, you just have to be able to articulate that. And that's sometimes difficult. And that's a hard part too in the interview process is, there are some really, really strong candidates out there who maybe can't articulate what their experience has been. And that's okay, we have to be able to do that as well. We have to be able to kind of coach through that. All right, so here's some of the things you said, some of the other things. Taking poor notes. We're going to talk about the decision matrix. It's got a note spots on it. If you do your handouts, you'll see that. We want you to take good notes when you do a peer interview. Because again, this whole team right here is going to do peer interviews on each, I'm the candidate, and each one of them are going to ask me questions. They need to take notes. Because a lot of times we don't remember. And if we've interviewed 14 people for one position, we're not going to remember everything about everybody. So we've got to take really good notes. What else? Decision-based, not probing, selling, yep. Okay. Clicker, there we go. Lack of training. This is why we're doing the stuff we're doing today. And it isn't just like today, after today, you're going to be expert peer interviewers, and you're going to know how to hire people really well. I didn't have this training when I was in the military. We didn't get a whole lot of opportunity to hire people, because they just gave us whoever. That's how it works. And so, I mean, I hired a few people over my years, and civilian folks that came to work in the military, but the military people, whoever showed up, you knew you were getting somebody, you knew what their name was, you knew what their rank was, you knew nothing else about them. Unless they had been somewhere else previously, then you could call out that place and find out what you were getting. But guess what? Even though you found out what you were getting, you couldn't stop the process. So you were stuck with what you got. So the lack of training. So we want to make sure that you're well trained. And again, it's not just going to happen today, it's going to be a process. And your team, you got a peer interview team that's going to help work through that. We go through a very long training in steer group. I'm not on the peer interview team for steer group. Not someplace, not because I'm not qualified, I just haven't gone down that training route yet. But we have a very strong training program to do that. All right, here's the thing about the screening process. We got the screening process, we got the manager interview, we got the peer interview, we got the first 90 days, we got all those things going on. So we got one here, one here, one here, one here. What does that say? It says 1 plus 1 plus 1 plus 1 does not equal 4. It equals what? It equals 1. It takes that many steps to get to one hire. And if we're not willing to do that, then what we're saying is we're willing to just take whoever, work with whatever, and continue to have turnover via concern. And when turnover gets really high in organizations, like I have one organization, when we started there, 28% turnover. I think you guys maybe have been up in, closer to that, maybe you were at 17 last year, up in the 20s before. That's a lot of turnover. That's a lot of expense. Who works in the OR? These are OR folks. You got this table, yeah, surgery, right? Nothing frustrates surgeons more than having a new nurse and tech show up, right? Now, they could have all the experience in the world, but they're not experienced it the way I like to do things here. That's frustrating. I mean, are there any surgeons in the room? I'll be nice. They like things the way they like things. And if I'm having surgery, I want them to like things the way they like things. And I want that staff to be as competent as possible. Now, I realize they might be experienced from other places, but I want that surgeon to feel comfortable with them. If we have turnover in organizations, that doesn't happen. So the surgeon gets frustrated, what happens to me as a patient? There's a chance that I might not have the best outcome. Not by anybody's fault, not by anybody's intent, just the nature of the process. So we want to make sure that we're doing everything we can to get the right interview process. All right, so here, let's take a break since we're right at this slide. We will take, what time is it, 9:55, let's take 8 minutes. We'll come right back, 8 minutes.